So before we go or start doing presbyopia correcting lenses, there are certain things that one should know, one should be aware of. One is that these lenses it's not perfect even now. As of this time, though I said these are interesting times, but these are not perfect. It is still a technology in evolution. So one should never use terms like you will get 6/6 and 6 and you won't have any problems. Never, it should not be a cut and dried promise. It should always be, most of the time or majority of the cases, some sort of thing we have to. But then nowadays it is much better. And it has not changed the situation that even now, whenever you choose a patient for this particular surgery, it is very important. The patient selection is very important. So that should never be compromised. The reason again is because still there is no 100% perfection as far as these lenses are concerned. So, because we don't need a good patient selection for doing a monofocal lens, because if they can afford, we can advise them. But here it is essential because this doesn't suit all patients and all patients are not happy with this. And one thing in that is to know about the patient. Patient questionnaire comes useful because we know what type of patient it is, what are the hobbies, what is the lifestyle of that patient to some extent. But this is not 100%. Sometimes you get surprises even in this. The patient you feel is a non-demanding, suddenly post-surgery becomes very demanding. So that we cannot all, but then 90% of the time you would be on the dot. And you should always have a good equipment because this is a precision surgery. If you don't, your biometry is not right, neither will the distance be correct nor the near. So you should have a good biometry. Ultrasound biometer with immersion is good enough if the person doing it knows his job or her job. You should use newer formula always, and that is all. Both are these new formulas are freely available on the net, so it should not be an issue. And your basic equipment should be good. Your good microscope and a phaco machine, and you should be good in phaco. Without that, one should not attempt. So certain fancy equipment, these are desirable if you have it, well and good. But if you don't have it, also doesn't mean you can't go ahead with this type of, or you can't adopt this technology. Optical biometers, nowadays it is most people, phaco surgeons do have it. And toric assisting devices, of course, these are very costly. Even I don't, we have a good practice, so we don't have that. But then, even if you don't have it, you can do quite well. And newer equipments like the anterior segment evaluating equipments like this one is the Sirius Plus. So where you can measure angle alpha and kappa. So that is important in these sort of lenses. But this angle should be less than 0.5 millimeters. So, if, fortunately, very rarely are these, you find patients with angle alpha kappa more than 0.5 millimeters. Most of the time, majority, more than 90% cases, they are well within the range. So that is why we don't have, even those who don't have this equipment and we are not able to measure this angle, well, you can still get away with good result. Because if you put a lens in such a patient with angle alpha or kappa more than 0.5, there's nothing much you can do. You just hope that the patient doesn't complain post-op. And then higher order aberrations also. The newer some equipments, they will give you information about the higher order aberrations that this patient will have. So if it is the patient has a significant higher order aberration, one should not select such patients for this particular type of surgery. So this is again showing the higher order aberrations. If that black bar goes in the red, then that means the aberrations are higher, and those patients should not be selected. So the tips for success when you go for this particular surgeries, again repeating the same thing, proper patient selection, accurate biometry, use of newer formulas, good surgical technique, and proper lens selection. So lenses, there are a huge lot of lenses now available in the market. We have the bifocals, the trifocals, the EDOF lenses, the EDOF, diffractive EDOFs, the non-diffractive EDOFs. So there is a big armamentarium of lenses. So what one has to do is that one has to understand the patient and choose the lens which you feel will be suitable for this particular patient, rather than going with the marketing hype, because sometimes some people will push one particular type of lens because they may be using that, they may have financial interest in that. But one should always maybe have some colleague, somebody who is doing it regularly and who will give you a frank opinion. So always one should ask such a person who, or a mentor who would guide you. As far as the surgery is concerned, uh, I mean, nothing very special. Only thing, all the steps should be right. Here I have marked the steep axis in the upper one, because even if 0.5 diopter of astigmatism can actually degrade the vision for distance and near. So for that, you need to mark the steep axis and put your incision on the steep axis so that you cut off some amount with your surgically induced astigmatism. Post surgery, you have to center it well. You have to see those Purkinje images are falling within the central, the innermost round of the lens. Both of these are diffractive EDOF lenses, and the lower one was it's a EDOF toric lens. These are in fact the synergy lenses. About these lenses, that in detail, the next speakers would be talking to you about that. So I'm not going into depth of these lenses. The important things are that one is the rexus should be well centered, the IOL should be well centered, the wound, there should not be leak, you should hydrate the wounds well, and it's always better to pre-hydrate before implanting the lens. And I always implant my lenses under irrigation. I do for all the cases, because removing the visco, that is the time when you actually cause a lot of unnecessary handling there. So if there is no visco, then there is no handling after that. And then not only the imported lenses, even a lot of good Indian lenses also there in the market. Like this was an Indian make lens by Care Group. So that also gives very good results. So it's not necessary that we have to choose the most costliest lenses. So in short, all these lenses give good results provided you choose the proper type of lens for the proper patient. So this, I already talked about the alignment. Unhappy patients, Dr. Srini will be talking to you about that. So whenever you have a complication, one should not use this lens, because if you have a problem where you are not able to put the lens in the bag, like a small rent you put in the bag, it's fine. But a big rent or zonular disease, we have to change the plan. We should be mentally prepared, and at the post-operatively, we tell the patient that this particular lens I could not use because that was not suiting for your eye. Optimizing results, binocular, always we have to advise both eyes, because only one eye, they will never be really very happy. When both eyes are there, that depth of perception will be better and near vision will be better. Neuroadaptation is a God-given gift to all phacosurgeons. So many patients, they eventually adapt to any whatever problems they have. So mix and match. Okay.